Good evening. This evening I'll be starting our series of health talk with a condition that affects newborn. This condition I'm talking about is one of the condition grouped together as obstetrics, brachial plexus injury. And the condition particularly is Erb's palsy. Erb's palsy is a condition that affects the nerve that supplies the arm. This nerve comes from the neck. So during childbirth, when these nerves are overstretched or pulled excessively, it can lead to damage. These damages will affect the movement of the arm. Now, what can make this nerve to be overstretched is during delivery, when the neck is pulled to one side and the arm goes to the other side. Overpulling at this stage may cause this condition known as Erb's palsy, because the nerves may be overstretched there. So, how will you know if your baby has Erb's palsy? Okay, when you notice that your baby is not moving the arm at all, or the movement is not as active as the movement from the other side, then you have to be more observant and call people to examine and make sure that your baby is not coming down with the condition known as Erb's palsy. So this is one of the conditions. There are so many conditions that can happen like this, but I'm just using this Erb's palsy as a typical example of one of such injuries that can happen during childbirth. Okay, what can predispose your baby to having this condition? One of them is prolonged labor. When your labor is prolonged, it can predispose your baby to having this condition known as Erb's palsy. Another condition that can predispose your baby to having this condition is excessive birth weight. When the baby's weight is more than 4.5 kilograms, it can predispose the baby to having this condition known as Erb's palsy. When the mother has diabetes during pregnancy, it can predispose this baby to having Erb's palsy. And when the pelvic is irregularly shaped or is too small to accommodate this baby's head, thereby forcing the matron or the midwife to exert excessive traction on the neck of the baby during childbirth, it can predispose your baby to having this condition known as Erb's palsy. So, if your baby is heavy and you are given the option of going for cesarean section, I will advise that you go for it, because this condition, when it happens, can be a lifelong disability that you will not like to see in your baby growing up. Though some may repair spontaneously, but most times what we say is that this injury goes into adulthood, thereby limiting the quality of life of this individual. So if you are given the option of CS during childbirth or during labor, please go for it to prevent a long life damage to your baby. Now, if you notice that your baby has this condition, or you've been told that the condition is there, or you notice yourself, please, the first thing you need to do, and you do it fast, is to seek the help of a medical personnel, especially a physiotherapist, that will start to work on your baby as soon as possible. Early intervention has been shown to have positive impact on this condition. The earlier you seek help, the better it is for the baby and for the entire family, because you don't want to see your baby growing up with disability. So the earlier you start intervention to start treating this condition, the better it is for you. Thank you.